They have so much money that they don't charge anyone to go to Harvard anymore. You're aware of that?
I was not aware. I was not aware of that.
Yeah, going to Harvard's free these days.
Wow. As long as you get
Yeah.
accepted, it's free.
You get accepted, it's free because they have so much money, and they have to give some of it away, or it doesn't look right. But they have so much money that they don't know what to do with it, so they're not charging tuition any longer. Now, I have had many patients when I was in active practice in anti-aging, and some of them very wealthy people, and they were very proud of all the money they gave to Harvard. And I said to them, and I say this to them all the time, I say, well, why aren't you giving money to me? Forget me. But why aren't you making a joke?
Yeah.
I said, why don't you give this money to, to some innovative anti-aging researcher or some, young, bright, not necessarily Harvard or Yale or whatever, big name, but do it to someone who's out of the box, who's trying to take a different tact, who's trying to come up with something new, who isn't stuck in the old paradigm, who has a chance of finding something new. And I was always amazed at their reasons for not doing that. They really were giving the money away not because they were so philanthropic, but they wanted their name on the side of a building so they could impress their friends. But my point is Harvard has $15 billion sitting in the bank.
Sure.
Do you really think that another $1 billion to Harvard is going to make any difference at all in research with regard to anti-aging? Do you think that the NIH that has a what's their annual budget right now, $25 billion?
25, yeah, maybe somewhere around there.
Somewhere around there.
Yeah.
Okay. I mean, please excuse me. I don't have these numbers at my fingertips, so I'm just talking in ballpark. So if any of your listeners get excited,
sure. I'm sure they can look it up.
25 years.
It's ballpark.
Maybe the number is 24 years. So
it's ballpark. Yeah.
Yeah, I'm just making a little, exception for myself right there. A little,
no problem. No problem there. But you're talking about
anyway. What about another $3 billion for the longevity dividend for NIH? Is anything going to change at the NIH with more money? And I say no, not a damn thing, because their focus is in the wrong direction. It has been since inception for the last 35 years.
Well, I know
NIH
that.
NIH is,
and you know
I know
that.
you know that. But NIH has been in business for how many years? 35 years now?
Yeah, it's been a while. Yeah.
And they've gone through what, $15-20 billion of public funding?
Every year.
No, they don't. They don't have that kind of budget. I think they have. I think their budget maybe is pushing $2 billion now.
$2 billion?
Yeah, $2 billion. And maybe last time I looked, it was like over $1 billion, $1.5 billion. But that was a while ago.
It up. Yeah.
Okay, but anyway, it's a lot of money no matter how you swing it. Okay? The last time I looked, and admittedly that was 5 years ago, of over $1 billion in public funding, less than $1 million was spent on basic science of aging in any aspect that could be referable to anti-aging.
Well, what I'm talking about here, with the longevity dividend and Olshansky and some of his other gerontologists, they want to set aside $3 billion for dedicated anti-aging research. Now,
I know, and who's going to do this? The same people who have been spending those other billions and billions, running down the wrong rat hole.
Yeah, I know. I think it's a good change.
And there you go.
I think it's a good change in perception, though.
Justin, thank you very much. You just said it yourself. You said, yeah, I know. And that's the whole reason why the American Academy of Anti-Aging Medicine has come into being. You see, if the American Aging Association, if the American Gerontologic Association, if the National Institute of Aging had been doing their job from the inception and had stayed with their original vision of finding causes and cures for aging-related disease, there would be no such thing as the American Academy of Anti-Aging Medicine.
Well, I suppose that is a point. That is a point you make.
These guys have become a lobbying group for the nursing homes and for the old age societies. And that's where 90% plus of the monies go.
Yeah, I know.
Okay?
I know what you're saying. I think it's a good change in direction.
So it gets me angry when I hear about people, like you mentioned, talking about the longevity dividend, because all they do is it's a false flag operation. They just take attention and focus away from what really counts, which is finding a cure, which is recognizing that aging is a treatable condition, and that a cure can be found, and that these are diseases that can be treated like any disease.
Sure. Now, I mean, will you at least say that someone has taken notice, and at least they're approaching Congress and saying we need to study the process of aging from a basic scientific level?
Only grudgingly.
Okay,
only because
I'll take
there
that.
are
I'll take that.
organizations like the American Academy of Anti-Aging Medicine who are embarrassing them by being public successes, international successes,
Sure.
by taking the right position. That's the only reason that the A4M is around. That's the only reason why the A4M is successful, because we've taken a position that makes sense and it has relevance to the public of planet Earth.
Okay. I just want to stop here, just pause for a second to remind anyone that's tuning in that you can ask questions if something pops up that you need clarification on, or you want to ask a question. You can post it in the chat box, and I also have a couple other questions for people who could not attend, some members and viewers who could not attend that I'll get to in just a bit. But I also now want to move on to another topic that I know some people in the mainstream, let's say, gerontology area of science here, that they have a criticism with hormone replacement and endocrinology therapies, that they don't have any verifiable proof of being able to slow the aging process or reverse it. And I know that A4M, just doing some casual reading, is very well versed, or very promotes, let's say, hormone replacement therapy, or HGH, using HGH to help oneself combat the effects of aging. And I just wanted to know if, maybe you could set us straight here, Dr. Klatz, if there is recent research at all that would show that hormone therapy does indeed reverse or slow down the aging process.
Well, Justin, it's very easy for me to debate science, because science is pretty much black and white.
Yeah.
Okay, if something works or it doesn't work.
Yeah.
You can point to studies. Sometimes there's controversy. Sometimes one study says yes, one study says no, and you can point to studies. But I can't deal with lies. You see, because how do you defeat a lie?
That's tough.
Okay.
Well, you got to bring up the evidence, I guess.
Well, it's a lie to say that hormone replacement therapy has no benefit for with age-related problems, and I'll tell you why.
Okay.
You would agree that osteoporosis is an aging-related disease.
I would say so. Yes. Yep.
Okay, most people,
very closely linked.
You would say that you'd have no problem talking about sarcopenia, the loss of muscle mass that occurs with aging, as an aging-related disease.
You're right. Yep, it is very highly linked with aging.
Right. Well, if you talk about testosterone or human growth hormone, both of those have a very valid and an indisputable role in treating both of those conditions. Growth hormone will not only repair bone, but it will repair vertebral bone, which is the hardest bone to repair, okay, and will actually increase bone mass in most people who are taking it for replacement purposes. Growth hormone and testosterone will both help to regenerate lost muscle mass that occurs with aging. Human growth hormone will increase nerve conduction velocity back to a more normal level in people who are growth hormone deficient. I mean, I could go on down and down and down. I could go on and on and on and on. There's many anecdotal reports of growth hormone improving vision, because it improves the strength of the muscles in the eye that are responsible for.
I've got your point here.
So if you have a drug like human growth hormone that works on all the cells of the body, because all the cells of the body have growth hormone receptors, and